Very much, Deputy President. I too rise to take note of the question from Senator Ruston of Minister Gallagher. I hardly know where to start with this appalling Labor policy. As other colleagues have said, it is absolutely detrimental to the health care of Australians, some of Australia's most vulnerable in rural, regional and also remote areas. Now, it was even worse when you consider that the government admitted during estimates that they had done not a second of consultation with people who might be concerned. So they've called a task force. Instead of actually going out and talking to the people of Western Australia, going out into regional and remote communities to talk to these communities who are so starved of GP care. Now, by the DP area classification, the DPA classification, now to include outer metro areas, is such a retrograde step for so many people in Western Australia. Because let me tell you what Labor has done to Western Australia in terms of health. We've got a health system in absolute crisis and chaos. We've got record ramping. We've got record code blacks. We've got our nurses in uproar and on strike. And now, not only are we 350 doctors short in our hospitals in Western Australia, young doctors short in our hospitals, we are over 100 GPs short, mostly in rural and remote communities. So what does that mean? That means that West Australians, who are our most vulnerable, who need health care the most, in Indigenous communities and in other remote areas, cannot get the health care they need. And this will make it worse. The Minister Butler, couldn't even say today how many communities were impacted. Well, let me tell you, if we're 100 GPs short in Western Australia, the vast majority of them are in regional and remote areas. And according to West Australian doctors, that means in every town without a GP or underserviced by GPs, that means there are 50 people a day who are not getting the support and the medical support they need. 50 people a day per doctor for our most vulnerable. So shame on Labor. Again, policy on the run and without even consulting anyone. So let me finish by providing some of the information that if Labor had actually come to Western Australia, gone out into regional Australia, they would find out. So as I've said, regional health is struggling by 100 doctors. We're missing and we cannot get, and about 50 patients a day. So even in areas that are closer to the city, take for example 2J, that they're now absolutely concerned because they're competing with Margaret River. We're competing with the coast, and they're now competing with outer suburbs of Perth. Shame on Labor.